Hello everyone, welcome back to our channel. Today we have an important topic to discuss that affects millions of people around the world, endometriosis. Whether you're personally dealing with it or know someone who is, understanding this condition is crucial. So let's dive right in. Endometriosis is a medical condition in which tissue similar to the lining of the uterus, called the endometrium, grows outside the uterus. This tissue can be found on organs in the pelvic area, such as the ovaries, fallopian tubes, and the outer surface of the uterus. In rare cases, it may also occur in other areas of the body. During a menstrual cycle, the endometrial tissue thickens in preparation for a potential pregnancy. If pregnancy doesn't occur, this tissue breaks down and is shed during menstruation. In endometriosis, the displaced tissue behaves similarly. It thickens, breaks down, and bleeds with each menstrual cycle. However, because this tissue is located outside the uterus, it doesn't have a way to exit the body. This can lead to irritation, inflammation, and the formation of scar tissue. Causes and risk factors. The exact causes of endometriosis are not entirely clear, but several factors are believed to contribute to its development. These include retrograde menstruation. This is one of the most widely accepted theories. It suggests that during menstruation, some of the menstrual blood containing endometrial cells flows backward through the fallopian tubes and into the pelvic cavity instead of exiting the body. These cells then adhere to the pelvic organs and continue to grow and bleed over time. Genetics. There appears to be a genetic component to endometriosis. Women with close relatives, such as a mother or sister, who have endometriosis are at a higher risk of developing the condition themselves. Hormonal imbalances. Abnormal levels of hormones, particularly estrogen, may contribute to the development of endometriosis. Estrogen is responsible for stimulating the growth of the endometrial tissue. Immune system dysfunction. Some researchers believe that a compromised immune system may not effectively eliminate misplaced endometrial cells, allowing them to grow and cause inflammation. Environmental factors. Exposure to certain environmental toxins, chemicals, or pollutants may increase the risk of developing endometriosis. However, more research is needed to establish specific links. Surgical history. Previous surgeries, such as cesarean sections or hysterectomies, may inadvertently spread endometrial tissue to other areas. Menstrual cycle length and flow. Short menstrual cycles, less than 27 days, or heavy menstrual flow may increase the likelihood of retrograde menstruation, which could contribute to endometriosis. Anatomical abnormalities. Some structural abnormalities in the reproductive organs or the pelvic region may make it more likely for endometrial tissue to attach and grow outside the uterus. It's important to note that while these factors may contribute to the development of endometriosis, they don't guarantee it will occur. Similarly, lacking these risk factors doesn't mean you won't develop the condition. Common symptoms. Endometriosis can manifest with a variety of symptoms, and it's important to note that the severity and combination of symptoms can vary widely from person to person. Common symptoms of endometriosis include pelvic pain. This is often the most prominent symptom. It may range from mild to severe and can occur at any time during the menstrual cycle. The pain may be described as sharp, stabbing, or cramp-like. Dysmenorrhea. This refers to severe menstrual cramps that may be more intense than what is considered normal. The pain may start before menstruation and last throughout the period. Painful intercourse. Many individuals with endometriosis experience pain during sexual intercourse, particularly deep penetration. Heavy menstrual bleeding. Endometriosis can lead to heavier or prolonged menstrual bleeding. Chronic lower back and pelvic pain. Some individuals experience a constant dull ache in the lower back and pelvis, which may intensify during menstruation. Painful bowel movements or urination. Endometrial implants can sometimes affect the bowel or bladder, leading to pain during bowel movements or urination, especially during menstruation. Gastrointestinal symptoms. These can include diarrhea, constipation, bloating, or nausea, particularly during menstruation. Fatigue. Chronic pain and the stress of dealing with a chronic condition can lead to fatigue and reduced energy levels. Infertility. While not always a symptom, endometriosis can sometimes lead to fertility issues due to the presence of endometrial tissue outside the uterus. Diagnosing and treating endometriosis typically involves a combination of medical history assessment, physical examination, imaging studies, and, in some cases, surgical intervention. Here's a breakdown of the process. Diagnosis. Medical history and symptom assessment. Your healthcare provider will start by asking about your menstrual cycle, pain symptoms, and any other related issues. They'll also inquire about your family history and any previous diagnoses of endometriosis. Physical examination. A pelvic exam may be performed to check for abnormalities, tenderness, or masses in the pelvic area. Imaging studies. Ultrasound. This non-invasive imaging technique can provide a preliminary view of the pelvic organs and may identify endometriotic cysts or other abnormalities. MRI. In some cases, a magnetic resonance imaging (MRI) scan may be recommended to get a more detailed view of the pelvis. Laparoscopy. This is considered the gold standard for diagnosing endometriosis. It's a minimally invasive surgical procedure in which a thin, lighted tube, laparoscope, is inserted through a small incision near the navel. This allows the surgeon to view and possibly remove endometriotic tissue for biopsy. Treatment. The treatment of endometriosis aims to manage symptoms, slow the growth of endometrial tissue, and improve quality of life. Treatment options may include pain management. Over-the-counter pain relievers like non-steroidal anti-inflammatory drugs, NSAIDs, can help alleviate pain associated with endometriosis. Hormone therapy. Birth control pills, hormonal patches, or hormonal IUDs can help regulate hormonal fluctuations and reduce pain. Gonadotropin-releasing hormone, GnRH, agonists. These medications temporarily induce a menopausal state, which can suppress endometrial growth. They are typically used for short periods due to potential side effects. Progestin therapy. Progestin-only medications can help thin the endometrial lining, reducing pain. Laparoscopic surgery. If endometriosis is confirmed through laparoscopy, the surgeon may remove or ablate burn endometrial tissue. This can provide relief from symptoms and, in some cases, improve fertility. Hysterectomy. In severe cases, a hysterectomy, removal of the uterus, may be recommended. This is typically considered a last resort option, and it may also involve removal of the ovaries and fallopian tubes. Salpingo-oophorectomy. Complementary therapies. Techniques such as acupuncture, dietary changes, and physical therapy may provide some relief for certain individuals. Fertility treatments. For those struggling with infertility due to endometriosis, assisted reproductive techniques like in vitro fertilization, IVF, may be an option. It's important to note that the best treatment plan will be individualized based on factors like the severity of the condition, the presence of fertility concerns, and the individual's overall health and preferences. A comprehensive discussion with a healthcare provider or a specialist in reproductive health is crucial for making informed decisions about the treatment of endometriosis. Remember, you're not alone in this journey. If you suspect you have endometriosis or know someone who does, seeking help is the first step towards managing this condition. That is all for today's video. Don't forget to like, share, and subscribe for more informative videos. Until next time, take care. Thanks for watching.